everyone, welcome to week 4. This week we're going to be covering chapter 21, which is all about the terminology used in administering medications. So we're going to be specifically looking at dosage forms and routes of administration and the terminology that goes along with those things. When we think of dosage forms, what we are thinking about is how the medicine comes. So it's going to be looking at two basic things: the actual physical state and the chemical composition of that drug. And we basically put them into 4 categories: solids, semi-solids, liquids, and gases. So when we think of solid drugs, these are all different types of solid drugs. So they can be in the tablet, caplet, capsule, and even liquid gels are in the solid drug form. Semi-solid refers to things like ointments and lotions and creams. And then liquid drugs can be liquid orals, like things we take by mouth, or it can be injectables. So these are just some pictures of some of the oral or liquid types of drugs. Now, the route of administration means how we actually get it into the body. And if you are not careful, if you use the wrong route, it can have a detrimental effect to your patient. So, you obviously are not going to inject an oral suspension into a patient. It can have detrimental effects. So that's an important thing to keep in mind as we go through this chapter. So the main delivery systems, we can do it orally, by mouth. We can do it by injection, which is called parenteral, by inhalation, or topical. So those are the main ways that we get the drugs into the body. Typically, our oral dosage forms have to be dissolved and disintegrated before they can be absorbed throughout the body. Specifically, sublingual tablets are dissolved under the tongue. So it has a little quicker mechanism of action, so it gets into the body a little bit quicker. So buccal are similar to that. Buccal are actually, if you think about someone who is a tobacco chewer, that space between the cheek and gum, that's where buccal tablets go. And a lot of these drugs are considered to be the most convenient route for most medications. So you will see those prescribed quite frequently. Here's just a quick example or a picture of the sublingual. That's under the tongue. And then buccal in that little space between the cheek and the gum. Now, parenteral dosages are best for those patients who maybe can't swallow, they've got nausea and vomiting, maybe they're unconscious. But the thing to keep in mind with the parenteral dosage forms is a lot of them are administered straight into the bloodstream, and so it's not easy to undo those doses. So if you make a mistake with a parenteral dosage, it's a lot more detrimental to our patient. Inhaled doses are also things that get there quickly, so they're inhaled directly into the respiratory tract. Topical is the ones that go on the skin or other mucous membranes, so we apply them directly onto the skin. Now, the next part of the chapter is going to go into some of the different equipment that's used for drug administration. These are just some examples. The gauge is the diameter of a needle, so that's something that you'll run across quite frequently, is what the gauge is of the needle. Let's see, the injector pen is something that's used quite frequently with subcutaneous or intramuscular injections. Things like Byetta. Some of the medications that are the patient administers to themselves have injector pens. So epinephrine, things like that are used for allergic reactions. Sorry, had a little brain fart there. We talk about a pump system. So it's just a way to administer intravenous medications using either an electronic or a manual pump. Syringes and vials are other common things that you're going to see when we talk about intravenous medications. So again, a lot of different dosage forms and terminology related to those dosage forms are included in this chapter. So it's really just important to become really familiar with these. And then last but not least, of course, there is the abbreviations associated with a lot of this terminology. D5W is a very common one. D5W refers to dextrose 5%. A lot of our intravenous medications are going to be added to a D5W bag. Normal saline is another one. So NS or N period S period. One of the things to keep in mind as you go through this chapter is the very last part of this chapter is a little bit about medication errors. And a medication error is simply a preventable event. And it can happen at any point in the process. So it can happen during prescribing. In other words, the doctor writes something wrong or it's not readable. Dispensing, so when we're actually doing the dispensing of the medication, or administering, so at the bedside or with the patient. And to prevent some of these errors, you need to become familiar with what we call the do not use list. So these are abbreviations that are recommended that we don't use to prevent some of these medication errors. So, there's going to be some things like, abbreviations for drug names, using things like QD. That's a real common one, or QOD. Some people don't know, is it every other or each other? They don't really know for sure. So they really recommend that you avoid using some of those. So you would write those things out. So again, as you are reviewing this week, if you have any problems or questions, please reach out to me. You can reach me by phone, text, or email. My number is 618-792-2293. Have a great week.